Hi, everyone. I'm Lisa Bowden, the product marketing lead for intelligent utilization management here at Availity. And with me today is Lydia Turner, senior strategy consultant at PwC. Lydia is going to expand a bit on some of the topics we introduced in our Reclaiming Utilization Management webinar. And we just can't wait to hear from her. Lydia, thank you so much for being with us today.
Yeah, thanks for having me. Great to be back to talk about this topic some more.
So, Lydia, let's look at what underpins some of that, which would be the medical policy, right? Because medical policy is the foundation for every determination in which means our policies need to reflect the current clinical evidence and be in a format that technology can use for automation or AI. So, I would love to hear if you could just unpack for us a little bit, why is medical policy maintenance so important? And what type of work needs to be done with medical policies to ensure they're a solid foundation for the automation and collaboration we've been talking about?
Yeah, Lisa, you just nailed it, right? The why medical policy is really the key to automation and RO driving ROI here is automation can only be as good as the policy it's built on. Medical policies are the decision logic behind every manual, automated, or AI supported decision that we make in the UM space. So if those policies are outdated, if they're ambiguous or they're inconsistently applied, automation is simply accelerating more wrong decisions, uh, which doesn't help us, right? That gets us faster, but not better. That leads to denials that don't align with current evidence, higher overturn rates, all of the abrasion with members and providers that we've already talked about, increased regulatory and provider risk. Just really the whole operation itself is fundamentally compromised without up to date and well maintained medical policies. So when policies are accurate, current, structured for technology, and to your point, in the format that technology can leverage, then you can get to the better and faster and cheaper all at once because you're using your technology efficiently. It's making quality decisions and it's doing it quickly in a way that a human touch can't necessarily do. And that's really where, ROI, all of the ROIs that we talked about, that's where this is realized. And without that foundation of strong and up-to-date medical policies, you're just going to be moving faster, maybe cheaper, but not better.
So let's talk a little bit, Lydia, about getting medical policy ready for technology to use, specifically AI. I know that 0057 states that policy should be digitized. What we've learned over the last few years, though, is that digitization does not necessarily equal automation. And a lot of times, the policy actually needs to be codified to work for today's AI environment. Have you seen that in your practice with health plans? And what are some of the best practices for codification? What can health plans keep in mind as they're inserting that logic into their policy to use with AI?
Absolutely. Historically, we've focused on writing good quality medical policies, right? That all the points we've made, you've got to have up to date and quality, medical policies that aren't ambiguous and aren't clear. What's changed for us now is the policies need to be written for clinicians as well as machines. We have to. It's about both the content as well as the format. So really, best practice as we are emerging into this kind of new era of is to start with structuring your policies in a really standardized codified format that separates out both the clinical intent with the operational rules. Both of those things need to be considered because if you're asking AI to learn, to read and learn and interpret, you have to have both the clinical intent as well as how that needs to be operationalized in a workflow. So those are both components that need to be contemplated as you develop and maintain medical policies. What that really means is even in the policy, how you're writing it in a way that can, for example, would be read by AI and turned into a survey that a provider can self-populate. If you're not writing it in a way that is easily operationalized and where a provider can your AI can interpret it and turn it into a question, and your provider can understand it and answer it clearly, that's not a good medical policy. So it's both the clinical intent and the operational rule. So those are sort of both components that I think payers are now starting to really reread and revisit their policies to make sure that they're accounting for both of those components. Additionally, policies need to be traceable to source evidence. We've got to point to why it is our policy. We got to back up our reason for one thing or another. Version control is super important as well. We're making decisions based on the policy at the time that we read the policy, right? But when we're doing an appeal or making a different determination in a week, if we don't have an audit history that that policy changed and how it changed, we can't really say that we've been consistent, right? It starts to introduce variability that we can't explain, even though it was explainable because we modified the policy. So having that version control and that audit history of how policies are changing is also critically important. A standardized review cadence, right? Whether that's on some sort of calendar schedule or there's an indicator based on new evidence that's emerging into the market that means that this policy or that policy needs to be reviewed and updated. But having some rigor and definition about how and when policies are revised or reviewed at least and revised. All of those are key. All of those are critical components to making sure that your policies are up to date and accessible and meaningful to members, providers, and the machines that are going to be helping us do our job. All of that gets kind of rolled up to what I would call just strong governance overall. So bringing together your clinicians, your operational teams, and your compliance stakeholders, really all to the table is all essential to ensuring that you're updating and in a timely and consistent manner across all of your workflows with your policies.
I love that. Thank you, Lydia. So I'm pretty clear now on how codifying medical policy actually ties all the way back to speed, cost, and quality. We can go faster, we can be more accurate, and we can reduce cost when policies are clear and codified. And we can reduce that provider abrasion by automating some of the attestation process. Makes great sense. You mentioned governance. We all recognize, of course, that there's a governance structure that wraps around transformation work. And I want to hear a little bit about your insights. What types of governance models support long term success? Do you have any insight into governance design and what's the best type of approach to use to ensure that the transformation is successful?
I think, in addition to both your clinicians and your technologies coming together, and we've kind of talked about that, the importance of shared ownership and and having a shared stakeholder in that. There's a couple other teams that need to be brought into that, right? So there's your clinical folks, there's your operations, your technology, and I would very much say that your analytics, your med econ team needs to be at the table too, ultimately making decisions about what services you require prior auth on, what those thresholds are, how you're going to operationalize those functions, and ultimately drive good quality care for members to control costs and have a positive ROI in your operation requires all of those insights to get the data insights that you need, the clinical insights you need, the operators to say this is how I'm going to make that happen, and your technologists to understand what you need as the technology enabler. So bringing all of those teams together, having clear roles, responsibilities, but really a shared ownership of the performance of the operation has been critical as we've built up that shared ownership is key in the governance model. Not just bringing teams together when issues arise, but having a repeatable sort of virtuous cycle of evaluation and feedback from all of those teams to get to those data insights to very clearly understand where you have opportunity for improvement, or you're having some sticky wickets that need remediation. But a comprehensive governance that includes all of those teams at the table with a shared ownership is critical, and what we're seeing in sort of this new world of kind of AI enabled
Great. I love it. So, one question on that front, because you've been out in the field and you've seen this happening on the front lines, what are some of the risks um, from having a lack of cross-functional alignment? And how can a health plan prevent them? So, give us an example perhaps of where we must collaborate, we must be one team, we must have shared accountability. But what are the risks of not doing that? And why is it so important that a health plan come together and have shared ownership?
Yeah, I think you get back to the old world where you can really only have two of our things, right? If you want to have better, faster, and cheaper, that you would need in a world that's AI enablement is how we do that, right? And leveraging our technology appropriately. Um, you can really only have two if you're not going to have all of those players at the table. You're going to end up making trade-offs with either compliance or ROI or really your technology enablement or provider and member experience. You're going to have a tremendous amount of frustration within your operation, right? In general, I think most payers would agree that there's tremendous turnover. We've pretty rapid turnover in our workforce. And that comes from both the internal experience of staff, right? And that usually comes from a miss on one of those four areas, either our operations, our clinical, our technology that causes tremendous frustration, not only to payers and providers or providers and members, but to the staff that's actually doing the work, right? Everybody wants to do a good job at their job. And not having sort of the measurement of performance and the feedback to learn and get better, the technology that's going to help you do your job, not just make your job harder. The leaders who can understand performance and say, yes, you've done a good job, or no, this is an area we need to improve on. Having back to what we talked about at the top, having that holistic management is what's going to make an operation consistently work better, faster, and cheaper. Without that governance, you're going to fail at one of the three, if not all.
Lydia, that has been so helpful. So helpful. And I'm thinking there might even be a future topic where we can talk a little bit. Yeah, we can talk to your Bill Gilligan. Yeah. Because of the turnover, right? And the pressures that a lot of our, especially clinicians, are facing. So maybe we can tackle that in our next conversation. Lydia, you have been so helpful and so insightful today. Thank you so much for your time and for joining us today. We appreciate your insights from the front lines, and we hope to see you again soon.